Good evening and thank you for joining us. I'm Faye. Remember, if you are new to our YouTube channel, please subscribe and like the videos and suggest to your friends and family that they watch these videos as well. It will help us, of course, grow more. Today, we're going to talk about an Oxfam report that has come out, and it's very interesting. It basically says that there were already sharp inequalities in the access to healthcare, right? And we knew that. We knew there is people of means that if you have enough money, you will have access to good hospitals, to good doctors, to good treatment. And we knew that that was not the case with the poor. But interestingly, what this report also tells us is that things have gotten worse after COVID. The poor have become poorer, we know, but they have even less access to healthcare. It has become more expensive, that we know. But apparently, the details of this report are quite stark. To help us understand why we've reached this point, at this year, we have Amitabh Behar, who is the Chief Executive Officer of Oxfam, join us right now. Mr. Behar, thank you for joining us. Good evening to you. Is it, we know that the government, by its own admission, made a large allocation to healthcare in the last union budget. We're in the middle of a pandemic. Is your report effectively telling us that we have not learned our lesson?
So, our report is telling us several lessons. Let me just flag those 3 or 4 big ones for us. COVID was clearly an X-ray which highlighted, amplified the fissures and the failures of the health system. So let me just say what it highlighted. The first one, the enormous inadequacy of the health system. And we really have data to tell us how enormously inadequate the health system is to be able to serve this country. The second big one is that with the growing inequality, what we're looking at is the disproportionate impact of this inequality, even in terms of health outcomes for the marginalized communities. The third, I would say, is, which you just said, that during COVID also, inequalities played out, and people from the marginalized backgrounds or from rural areas were not able to access COVID facilities as per their counterparts from say, urban areas. And the fourth, I think, which is really the topmost for me, is that it is pretty much like we are driving blindfolded. And there was this massive earthquake in the form of COVID, one, and again another massive earthquake, probably bigger in the form of COVID, second phase. And we have not woken up. We are still on the same trajectory towards collapse. And that's the big story. We need to really wake up if we want different outcomes. And just one minor correction with a data point from what you said. I would say that it was, if you look at the union budget in greater detail, there was actually a cut in the allocation for the Ministry of Health, and a cut of 9.8% from the revised estimates of the previous year. So that's a massive cut during COVID.
So, Mr. Behar, tell me something. Did the access to healthcare, like you say, post-COVID, become more difficult for the poor in our country because they became poorer? As we have seen your previous reports tell us that the wealth inequality, the rich have become far richer, the poor have become far poorer. Is that the reason why this has happened? Because if we say health inequality, you're measuring doctor to number of patients, you're measuring bed to the number of patients. How could that have possibly gotten worse during COVID?
So the health infrastructure is one of the most important parts of the story. But let me just say that, to try and respond directly to the question that you have, let's look at the number of hospital beds. So first, let me give you the data. We have only 0.5 beds for every 1,000 population in this country, whereas it should be, according to the WHO norms, 5 beds per 1,000. And we're really way behind other countries. So, for instance, Mexico has close to 1 bed. Bangladesh has 0.87, and Chile is more than 2 beds per 1,000. But what I wanted to say in terms of looking at the inequality question, I think what's important is that only 40% of these beds are in rural areas, where 70% of the population lives in rural areas. So that's the stark inequality we're looking at. So the infrastructure, the way it's distributed, also ends up in terms of unequal access. And then we did see, as in we've done a survey post-COVID phase 1, where we are clearly seeing that different communities have had difficulty in accessing the COVID healthcare. So, for instance, 50% of the scheduled caste and scheduled tribes found accessing non-COVID medical care extremely difficult during the COVID times, whereas only 18% of the general population found it difficult. So there are layers to the difficulty that we're talking of, and how it's unequal access for different communities.
Well, interestingly, yesterday in Rajya Sabha, there was a question that was raised. This was the 20th of July. It was not yesterday, it was day before yesterday. When one MP asked the government and the health ministry how many doctors and nurses succumbed to COVID altogether. And the health minister responds saying, we do not have that data. The ministry, he suggested though that the ministry keep a record going forward. Is this perhaps a symptom of how poorly we have treated this problem, how poorly we've looked after our healthcare staff? And if we don't even know how many of them we've lost, how are we maintaining the balance of patients to doctors in this country?
Absolutely. As in we've been celebrating the work the doctors have been doing. That sounds absolutely empty rhetoric when you listen to the answer that you've just talked of. It's completely empty. What I would also say is that there's a larger issue that we need to talk of, and that is about data, which cuts across. It's so difficult to get data on the social sector, and it's not available, and therefore we need to do primary surveys, we need to look at secondary literature. That's another problem. But what you're saying about the answer, it's clear that the government does not look at health as a top priority, even post-COVID. It does not see health as a politically important priority. And that gets reflected in how we treat the health system in this country.
The other things that we must talk about right now, and we've had a change in the health ministry. I was just, reading out a statement that was made in Parliament by our new health minister. Do you, as someone who's watching the health ministry closely at this point, expect any change in the handling of the problem from one health minister to another?
So I don't think that there's going to be any change because this is not about the health minister. It is about how do we look at health as an issue in this country. And what really is heartbreaking, that we have seen, even according to government figures, 4 lakh people dying of COVID, which now we know is hugely underreported. Pretty much every study is saying that it is at least 5 to 10 times more than the numbers officially announced by the government. And even during this time, we are not seeing fundamental changes in how health is looked at. The example that I gave, in the middle of this crisis, if you actually cut the budget of the health sector, what is the message that you're giving out? And that's really the big question that we need to address, that our infrastructure is absolutely inadequate. And we have not looked at it. And what we have done, even in terms of the trajectory, what we're trying to do is say that, okay, the public health system is not robust enough, and almost giving up that we cannot make it robust. So at best, let's work with some insurance schemes, and which have not delivered.
I'll come to that. I just want to take your answer one by one. You first talked about the fact that you said that there are many reports that believe that India's numbers of deaths by COVID are vastly undercounted. Again, today, this Union Health Ministry has put out a statement saying that India's death registration system is very robust, and the odds of us missing deaths are completely unlikely. And so these reports that you're referring to are totally fallacious. And we also know that the government has said that no one died of the lack of oxygen. in most of our states, and there are several states that have now supported that statement. That's one. Now, again, that brings us to, and I want to start from the idea of data, right? If our data is flawed, then all planning that is made based on that data will also be flawed.
Sure.
So do you believe that this is an inherited problem of recording flawed data, or are we trying to cover up?
So, two responses. One, as in you were smiling, I was smiling, because, it sounds so bizarre, but it is a grim reality.
Yeah.
I don't have a massive network. I do work with a whole range of actors across the country. But let me tell you that from April to May, I was getting news of at least 2 to 3 people who died of COVID. It was an extremely painful time. We have lost one of our own colleagues. I know of several friends in civil society who have passed away. And if the government now tells me that it's just 4 lakh in a country of 130 crores, I'm not going to accept it. Just as a citizen who doesn't even look at numbers, just my own experience tells me that this is extremely inadequate. And let's also get real. It's not one study. There are several different studies, as in the latest study that I've seen from Arvind Subramaniam. He's even taking 3 different data sets, and he's coming to the conclusion that it is going to be somewhere from 30 to 50 lakhs. That's the amount that you're looking at. The second, I would say that, for the larger story that we are talking of, even if you don't look at this data, there's enough data from the government which tells us that our health system is completely overwhelmed. It is not ready for universal health coverage. That's the bottom line. So without, getting sidetracked in this story, I would challenge the government to look at its own data and then try and explain how can we achieve universal health coverage with the data they have, with the investments they make.
Well, there's an interesting question from Shubhashlok, who has said, good evening. Does health inequality stem from the fact that health is primarily a state subject? However, state governments have far lower resources and streams of revenue to spend on health. Whose responsibility is it? We've seen this play out a lot, Amitabh, but in court, we've had center and various state governments sort of kick the ball into each other's court, saying, no, it's your responsibility, it's your responsibility. We don't really know whose responsibility is it. Is it the state's responsibility?
I'm pretty surprised that in the middle of this pandemic and the harrowing time we've all gone through, if we are really passing the buck, because for me, this is not a party political question. It is not an immediate political question. It's a much larger political question of how can we make health as a critical issue, the well-being and the dignity of citizens as a central question. And this is about coordinating between the union government and the state government. So, and I would, let me also say, this is one story where you can't say it is just about the NDA. It is a problem that has actually got accentuated over the decades. So we need to really look at it and start addressing the problem. The issue is that we are not willing to acknowledge that the health system is inadequate. Insurance is not a response. Privatization of public health system is not a solution. So I would really say that's the big challenge. We can get caught in whether it is Delhi government or whether it is the government of India, and that might make nice headlines, but that's not where the solution lies.
Right. There's another question here from Shelly. He says, how badly will this affect the third wave? Can it be fixed? Effectively, I think he's asking if we're ready, or if what your report says actually sets us back in terms of preparedness, because we've had a lot of talk about the fact that we need to be ready for the possibility of the third wave hitting our children, of the third wave being perhaps maybe more contagious because of a Delta Plus variant. Are we prepared?
That's really for the doctors to say in terms of the intensity of the wave. But in terms of the infrastructure, we are certainly not there. And that's critical. And we've seen that. Just imagine, let me just take you back to another data point. We have only 0.6 doctors for every 1,000. And that's one doctor, as in this is, I'm talking of doctors, which includes from Siddha to Ayurveda, etc., all systems of medicine. But if you look at the allopathic doctors, it's one doctor for 10,300 or 200 people. That's the level of inadequacy that we're looking at. So until unless we start addressing it, I doubt we'll be able to handle this. And nurses, and we saw this during COVID, we have or just 1.7 nurses for every 1,000, whereas the WHO norm is it should be 3. So what you're looking at is almost a 45%, 43% shortfall. So
But
these are specific.
Amitabh, let me ask you this, and this is a genuine question. And I saw somebody else also talk about how there are so many Indian doctors right now on US television panels because they all work overseas. And we know this, the brightest minds in our country choose to go work overseas, both as doctors and as nurses, and maybe come back only when they are in a position where they can afford a really elite practice. Working in public sector healthcare is made extremely unpleasant. And so a lot of the times, the doctors who can help it choose not to do so. Where is the solution here? We have a government that's constantly talking about creating new aims, which means new universities and new colleges where we can make more doctors per se. We know we have a population that wants all their children to be doctors. Everybody wants their kids to either be doctors or engineers in our country. So where are we missing? What do we need to fix in order to fix the problem of doctor-patient ratio in India?
So Faye, the first one is that, again, even with the meager allocation that we have looked at, we get our priorities wrong. I think we have to have a clear emphasis on primary healthcare. But let me also say this is not in lieu of secondary or tertiary healthcare. At the moment, our investments on healthcare are so low. We are investing only 1.25% of GDP, whereas successive governments over the last several decades, I've been following policy since the mid-90s. Since then, every government, every even 5-year plan said it should be up to 3%. Every political manifesto says 2 to 3%, and we're still hovering around 1.25%. And let me also put this in context in terms of BRICS. Let me give you the numbers because it's startling.
Yes.
Brazil puts 9.2% of its GDP on health. South Africa, 8.1%. Russia, 5.3%. China, 5%. Even Bhutan is putting 2.5% and Sri Lanka is 1.6%. So if we don't invest, that's where the problem starts. If you're not willing to put your resources there, how will you set the system right? And yes, after that, we'll need to look at the incentive structures. We will need to look at why it's unpleasant. But at this moment, it is pretty clear that the public health system is orphaned politically, as well in terms of any serious policy intent. And the solution seems that, okay, let's go to Ayushman Bharat, which we again saw during COVID that it did not deliver.
What is your evidence to say that Ayushman Bharat did not deliver?
So yeah, sure. So let me just give you again a couple of pieces from the data that we have. Till October 6, 2020, that's the data we have for Ayushman Bharat. Of all the people who are registered under the scheme and hospitalized, only 65% were able to get their claims from the Ayushman Bharat. So 35% people did not get their claims. Let me also give you another data point. That Ayushman Bharat, the average bills paid is 11,545. Whereas if you actually look at the average medical expenditure in rural areas, it's 16,676. And in urban areas, it's 26,475. So almost a shortfall in rural areas of 5,000 and almost of 10 plus thousand in urban areas. So that's the claim being given by Ayushman Bharat, whereas the actual expenditure is much higher. And then let's also face it. Ayushman Bharat is looking at inpatient support, whereas we do know that most of the expenditure also happens in terms of diagnostics, consulting, medicines, etc. I'm just too tempted to, I know you want to ask the next question, but let me give you one more data point because that's startling. The out-of-pocket expenditure in India is 64.2%. Let me just say it again, it's 64.2%. The global average is only 18.2%. So just look at the difference. This is what leads to poverty. We know every year how 6 to 10 crore people slide into poverty because of just one illness in the family.
Yes. And you did say very importantly that it's not just the in-hospital infrastructure, but it's everything around it as well. Whether or not we're feeding our children, how they're going to grow into, whether or not they're going to grow into healthy adults, whether or not the women who are giving babies are adequately fed and given enough nutrition, and are they going to give birth to healthy babies? And of course, then finally, prevention and education. One of the challenges that we found as we went into COVID and through the second wave was that lack of ambulances, was lack of oxygenated ambulances, testing facilities. Many states like Uttarakhand, for example, we had friends calling us saying we have to travel a great deal to get a test done and then come back. It was a day's work to just get a test done. So when we say health infrastructure, and this is the government's allocation to health infrastructure, is there a need to also look at the breakup of that allocation and see where the money is really going?
Sure, as we certainly should do that. And I've kind of given you the deficit that we are looking at, whether it's in terms of the doctors, in terms of nurses, even in terms of the health centers. Again, let me just give you a little more data that you have a deficit of 23% sub-centers, a deficit of 28% when it comes to the PHCs, and a deficit of 37% when it's the community health centers. So again, there's a huge deficit even in terms of the actual the infrastructure that we have created, and we've seen the pictures which we saw over the last few months of a public health center actually being used as a storage, and those are not random stories, and those are not unique health centers. That happens across many parts of the country. So certainly we need to look at where the investments are, but we need to start with taking this oath to actually enhance our healthcare budgets, without which we are not changing this very, very fundamental challenge that India has.
I think fundamentally, based on a couple of reports that Oxfam has put up, one of the things that we have to learn as citizens is that we need to start voting based on healthcare and education. They're the foundation on which we're going to build our families and our children. And without these two things, nothing else is really deserving of your vote. And unfortunately, the Indian population doesn't base its vote on results on healthcare and education.
Can I just add to that, Faye? I so completely agree. But let me say that we need to probably take it a couple of steps ahead. So one is about the voting day. But I think we made this mistake in the first few decades of post-independence. We started believing that democracy is about democracy once in 5 years. I think we need to start moving at holding government to account, whether through our reports, through Jan Sunwais, social audits, on a daily basis. Because that's how I think we can move towards substantive democracy. And democracy is it's a lot of work. It's building it brick by brick. And that's what citizens need to do. You cannot have a government tell us, and I feel very, very angry to hear a technical response that nobody died of lack of oxygen. We have seen that. I have lost a personal friend who died because of lack of oxygen. And for me to even hear again, just as a citizen, to hear that there was no lack of oxygen, which cause deaths is outrageous.
But do you think, Amitabh, that this could actually, you said it's a technical reason, right? Because at the end of the day, I'm trying to imagine how this could have possibly happened, how such a statement could have been made. But if you consider the way deaths are recorded in India, someone has severe COVID waiting outside the hospital for admission and for a bed, dies outside the hospital. What is the cause of death on the death certificate? Severe COVID, not the lack of a bed or the lack of oxygen, right?
Yeah, I agree. That's why I said, as in I understand that there would be loopholes probably if you take it to the court of law. Then they will say that this was the reason, it's how it's recorded, etc., etc. But the parliament and the government in the times of at least this pandemic and the tragedies that we have seen, you are not expecting a technical response. As it could have at least been an emotional response of reaching out to people who have lost their loved ones. It was not even that. It is pretty much saying that we don't care for you, and you might have lost your loved ones, but we have our own story. That's unacceptable. I just can't fathom how even politically does it really make sense.
And in fact, stepping away from the technicality, if the data that we have accumulated is flawed, like I keep saying, then every plan to mitigate COVID and to fight it in the future, whether it is wave 3 or 4 or 5 or 6 or how many ever we have to accept, will all be flawed because they will be based on flawed data. If we don't know how many people died for the lack of oxygen, which we can all be very clear about the fact they did, then to answer, Shaldi's question, we are not prepared for a third wave because we're pretending that half the things that happened in the second wave didn't really happen, which is where reports like what Oxfam has brought about today and yesterday is really, really important. Amitabh Behar, thank you so much for making time to speak with me and my audience. It was a pleasure to have this conversation with you. Thank you.
Thank you, Faye. Thanks a lot.
For our audience, remember the news is up at 9 o'clock as we do every day. We have a quiz as well. For my guys in the chat window, thank you so much for making my dad feel welcome. My dad was watching the show today. Everyone's being really sweet. We do hope, though, that the government will start taking health more seriously. There couldn't have been a starker sort of realization how bad we are than what has happened in the last 1 year. I mean, never mind the first wave, what's happened in the second wave was completely shocking and unbelievable. And it turns out the government doesn't believe it happened at all. So we have many, many questions to ask and hopefully more answers that we will get.